There we go. All right, we're recording now.
Okay, great. So the proponents of Measure 110 would go ahead and tell us a little bit about it and why it's a good idea. We'd appreciate that.
Brent, take it off.
Yeah, I will, and I'll turn it to you, Anthony. So my name is Brent Canode. I work as the executive director of the Alano Club of Portland, also a person in long-term recovery. Work in a variety of capacities with other recovery organizations, was a co-founder of Harmony Academy, actually co-founded Oregon Recovers with Mike Marshall, who's with us today, and work as a section editor for the Journal of Recovery Science. To put it as bluntly as possible, I don't think we have seen a ballot measure in Oregon that is as transformational as 110. I mean, often with ballot measures, we're given an opportunity to be real tactical and strategic and address one specific issue, but 110 brings systemic transformational change across systems. So first and foremost, it addresses Oregon's very racist system of incarceration, which is embedded in old drug war policies that impact communities of color disproportionately. But what it also does is it generates almost $100 million in new funding for Oregon's beleaguered addiction support system, which is consistently ranked near the bottom of the barrel across the United States for both adults and adolescents. So we're talking about the largest infusion of new dollars into a system that needs it now more than ever. If you read most of the public health experts' prognosis for the next 3 to 5 years, we're going to be facing a behavioral health pandemic that will absolutely dwarf COVID-19. So there's never been a need for new resources. This does it, and it does it in a really innovative and strategic way. It gets monies to communities who are impacted most. So instead of putting money into the Medicaid pipeline, which feeds the same treatment centers, this money goes directly to community-based organizations like Miracles, like Fourth Dimension, like the Alano Club of Portland, to deliver services that are needed most. We know that most people impacted by substance use disorders, especially those caught up in petty possession charges, fall in the mild to moderate criteria on the substance use disorder continuum. Those folks don't need treatment. They often do just as well, if not better, with comprehensive peer support and recovery support housing, and that's exactly what this measure delivers. And those are two components of our systems that have been underfunded for decades. And so for all those reasons and more, you're here today. We are so excited to be talking about Measure 110 and really setting the tone for the nation. And I will end on this. I find it a little surreal to be in this conversation today because as a co-founder of Oregon Recovers, this is something Mike Marshall and I, dreamed about and talked about in 2017 when we talked about a 5-year plan for Oregon that would end with a ballot measure to enhance and fund services. So I am still hopeful that by the time we get to November 3rd, we're all going to be on the right side of history and pushing forward this amazing measure. Thank you.
Great, thanks. So we'll ask the no side now to introduce their objections to the measure.
Good morning, I'm James O'Rourke. I'm a parent of 2 children who suffer from addiction. I'm a person in long-term recovery, 35 years, and for the last 35 of my 42 years as a criminal defense lawyer, I have focused on keeping people out of jail and getting them into treatment in the criminal justice system in Oregon, in most counties. Measure 110 is dangerous for children. Measure 110 would decriminalize possession of addictive, lethal drugs for children, teens, and adults in Oregon while we're in the midst of an addiction epidemic. In addition, Measure 110 would take away $56 million from addiction treatment and prevention and $90 million from schools through the end of the next biennium. If Measure 110 passes, a 15-year-old caught with just under 1 gram of heroin or just under 2 grams of meth or cocaine or up to 39 user units of oxycodone or methadone would be subject to a maximum consequence of a $100 fine or a health assessment, not an addiction assessment. Not only would most children not hold those quantities, they would learn not to possess larger amounts so they could stay outside of the reach of the juvenile courts. Thus, not only would Measure 110 decriminalize these highly addictive, lethal drugs for children, it would take away what is for many children, teens, and families the most effective and only pathway to treatment, which is through the juvenile courts. Right now, if a child or adult is caught possessing these drugs in Oregon, they are offered state-funded treatment, which includes trained addiction counselors, culturally specific recovery resources, and a high-quality inpatient and outpatient treatment. These are life-saving services, which many young people and families could not otherwise afford. Measure 110 would take away this proven intervention, diversion, and treatment system. The intervention component is essential because most people suffering from addiction cannot intervene upon themselves, nor can they stop using drugs on their own. Juvenile courts use the same intervention model that the medical and other health professional boards use to get professionals to go to and complete treatment. They use the external motivation, monitoring, and accountability. These are the most successful, this is the most successful system of treatment we have. Measure 110 provides no system to replace this highly effective model. Thus, Measure 110 will abandon thousands of children and adults each year who could have been helped by the present system to suffer in addiction while risking disease and death every day while their parents are helpless to get them into treatment and recovery. We should not disrupt the juvenile court intervention and treatment programs until we have something in place that is proven to work in Oregon that works at least as well. Thank you.
So Brent or others on the yes side, I'd like you to address that concern, which is one of the loudest concerns we've heard from opponents of the measure, that the referral method or the current system of getting people into treatment while they may not want it is an effective pathway, and this ends that pathway without providing a new one. Could you respond to that, please?
Yeah, happy to. So I think, and this is what's challenging, I think, in this space, right, is that often the anecdotal will override the empirical. And I think this is a prime example of this. Almost every major study and meta-analysis of the effects of compulsory treatment, especially drug treatment, show that after 2 to 3 years, the treatment effect actually wears off, that the outcomes people experience are no greater than those who didn't go to treatment at all. And those research studies are widely available. So I think the idea that incarceration or adjudicated recovery is an effective pathway is not true. It's been an effective pathway only, and that's the only pathway that we've offered to individuals caught up in the criminal justice system, but it's by no means evidence-based or effective. And that research is plentiful. In terms of the adolescent piece, I think what's exciting for me as an individual involved in opening a new adolescent treatment center next month is that most treatment centers are funded through Medicaid dollars. And so that presents a lot of barriers when you have to take insurance, when people don't have access to certain support services that aren't paid for by Medicaid dollars, like peer support. So there's a new model of adolescent treatment that's really built around robust peer supports. And with this type of funding that comes from Measure 110, we'll actually be able to increase, not decrease, adolescent treatment. I think that calling juvenile justice adolescent treatment is a real misnomer. We know that every juvenile who touches the juvenile justice system is stigmatized and suffers traumatic consequences from that interaction. So I think when we look at it in sum, it's not an effective pathway, but there is effective pathways coming that could be funded through Measure 110 dollars.
Yeah, I think this is a similar argument we've had around marijuana legalization of what about the kids, and that if you legalize or decriminalize, and in this with Measure 110, we're reducing criminal penalties for possession offenses. Those possession offenses aren't getting people state-funded treatment. And what is carried out for rich people or rich kids versus Black kids and indigenous kids and people don't have the means, they're not getting quality treatment. All they're getting is a criminal record and getting ensnared in the criminal justice system. They're getting put on probation that they can't follow through, and it's only harming them without any type of state-funded treatment. Whereas under Measure 110, instead of getting a phone call that your kid's in jail, you're gonna get a phone call that, hey, these are the treatment options in your area. And Measure 110 provides a scaffolding for a system. And so the preferred juvenile system that Jim O'Rourke or anybody wants is possible under Measure 110, but this current system today, Jim O'Rourke thinks, it's working well for kids, but we would say it's not working well, and we need a new approach, not based on criminal punishment, but based on a health-based approach around treatment and recovery services.
Hey, Nigel, kick it up.
Okay.
My name is Bobby Bird, and I'm here and I'm interested in racial justice myself. And what they're talking about right now, I'm part of. I'm an organizer on the campaign Measure 110 staff, and I've been encouraged by the increased support of the Black Lives Matter movement. Now, unfortunately, our racist drug laws and over-policing has hindered my life tremendously as a Black man. 27 years ago, I was arrested for a small amount of drugs, and I thank God that I didn't lose my life like so many black men have, or like Breonna Taylor or George Floyd has. Every police encounter possesses a threat for black people. This may be hard for you to understand unless you've lived it or walked in my shoes, but after talking to some of my white friends, I've been pulled over more times in 1 month than many of them have been pulled over in their whole entire lives. Mm-hmm. Now, to live with the fear every day of leaving my home just to go to the grocery store or to a gas station or something just for regular appointments and not know, and the fear was that I might not come back home to my family because I might get pulled over or thrown in jail for no reason at all. Although I've been clean since 1993, that case has followed me for all my life. I've dedicated my time, my life to my kids. That hurt my ability to provide for my kids. I decided that I would dedicate my life to my son and my daughter. And now losing those opportunities over 2.5 decades ago. And this is what you're talking about. When you straddle a kid with a criminal record, this follows them for the rest of their life, man. Yep. This is just not something that you can just go get. You can't go get a job at Intel, Wells Fargo. You can't go do those things, man.
Hey, Nigel, in the interest of time, can I jump in here?
Now, that being said, know this, our current drug laws are indeed the new Jim Crow. This is not, this, what are we talking about, man? Right. You're saying that our current system is flawed. Our current system is flawed. Please understand our current system is flawed. It does not work. We need to go ahead and move forward with this.
And on that point that Bobby said, Nigel, I just want to say that at the Alano Club of Portland, we ran a recovery expungement clinic for 6 months. For 6 months as a trial project with Multnomah public defenders. And during that time, we had to expunge over 700 felonies from over 137 participants. These are people that have been in recovery for 10, 15, 20 years who were never able to move on with their lives, who weren't able to get supportive housing, who weren't able to find employment, all because of a charge that they had for a health condition that no longer existed.
Yeah. All right, Mike, you want to jump in? Mike Marshall?
Yeah, sure. So the challenge with this, and I appreciate what everyone said because I agree with 90% of it. We have in a ballot measure that the intent of the Drug Policy Alliance in New York is spending $5 million on this is to end the drug war in America. And we all agree with that. And then I think everybody on this call equally has worked hard to end the addiction crisis in Oregon. And they're two separate things in many ways. And so I would say, I would, well, hold on. I will. Sadly, I don't think it goes far enough. And I am totally empathetic to Bobby Bird, what he's gone through. But number one, this doesn't include any expungement. Number two, it doesn't stop driving while black. I mean, it has absolutely nothing. There's no racial equity aspect of this. Number three, it doesn't even include an apology for the war on drugs, which I think the people of Oregon would have overwhelmingly voted for and would have helped really frame this issue as, even with its faults, let's start there and acknowledge that this sucks. But then we also have to look at how does it end the addiction crisis in Oregon, which today will impact, according to SAMHSA, 400,000 individuals, which means countless more families, right? And so this will reduce the number of people going into treatment.
That's not true.
According to the criminal. Hold on, Brent.
Brent, let Mike finish, please.
According to the Criminal Justice Commission in 2019, this would have impacted positively 3,700 people. In that they would not have been convicted of a misdemeanor or a felony. They'll instead would have gotten a ticket. But that also meant that a pathway for some of them to treatment would have been cut off, because with a ticket, you no longer have access to the court system that since 2017, when the legislature started decriminalizing drugs, they put money in there for the local courts to be able to facilitate people going into treatment. Now, has it been applied equally? No. And so again, this measure doesn't change any of that. Lastly, to Brent's point, which is, yes, we set out to increase funding dramatically after we had a design process of a new system of care, which the state has done. This doesn't generate new revenue. Brent, you said it generates new revenue.
It does, Mike.
It takes money away from
If you look at
hold on, hold on.
If you look at the cannabis distribution,
Look at the legislature. The legislature
no,
said.
if you look at the distribution,
Brent, look at the legislative analysis. Nigel, I urge you to look at the legislative analysis. In the first 6 months of 2021, as we experience, as Brent said, this unprecedented behavioral health spike, we're going to move $28 million out of county mental health and addiction programs. And then in next
increase funding by $100 million. So the net gain.
No, you're not. You're putting it into a bureaucracy. It's going
directly to community organizations.
No, it's not. It's going to a commission.
Go by grants.
All right.
It's going to a commission with the Oregon Health Authority. And then they have to meet.
Now it's going to go directly to community organizations.
Brent,
No, it's not.
Brent, Mike,
name one organization listed in there that's going to be funded.
Mike, I want you guys both, we don't need to see a repeat of the presidential debate here, guys, okay? I asked you at the beginning, remain civil, don't speak over each other. I've got a couple of questions. Brent, you said it would bring new money in. Obviously, with all due respect, that's not true because this is a redirection of an existing stream of money. So let's be honest about that.
How that money, so let me clarify that, Nigel. So it is a redirection of that money to treatment and recovery support services. So you look at the way the cannabis distribution happens now, there will be more money going to treatment organizations, less money going to other recipients of that fund.
And if I could jump in,
It's a redistribution.
but there are
money. So
a redistribution with a net increase.
Guys, we're here for you guys to answer our questions, please. So my questions to you, Brent, about that redistribution, will it create any new treatment beds?
So will it create, no, because our argument, one, is that treatment beds serve a small fraction of the population. As I said in my opening statement, most people do not need a treatment bed. If you look at the science, most people need, on the mild to moderate spectrum, which is what you are catching with petty drug possession charges, need peer supports, they need community-based supports, and they need supportive housing. Those are the parts of the system that are underfunded and would now receive a robust infusion of dollars to really round out our treatment system.
I will also jump in.
Second question. Yep. Haven, I just have one more question. Maybe you could answer this one also. The second question I had, Brent, the distribution mechanism of the money to the regional centers that are what will triage patients. How's that distribution going to work? I didn't see anything in the measure. Maybe I missed it about that.
Yeah, can I jump in on that one?
Anthony,
sure. So first of all, there will be new revenue, new money for treatment and recovery programs from law enforcement savings. The state financial estimate committee projects $12 million a year, but says that's going to go up after the next full biennium. Eco Northwest did a study and says it can be upwards of $30 to $45 million a year from law enforcement savings from not arresting 8,000 people and not convicting 3,700 people for low-level misdemeanor possession charges. So there will be new revenue from law enforcement savings. And the addiction and recovery centers can be existing centers that are funded by reallocated cannabis tax revenue, which the state projects to be at least $90 million a year the next biennium, when the state currently spends $25 million a year in non-Medicaid funding. So it's an increase of that. So you got $100 million plus it can create more treatment beds because we leave it open to people that know this issue the best. We create an oversight and accountability council, which provide grants to community organizations that will apply for the funds and put it to the things that they need most. So what Alano Club may need, or what Bridges to Change may need, or what Miracles Club may need, or what somebody in Eastern Oregon or on the coast may need, it can adapt to what the local community needs that's culturally specific.
Can you be specific about how that allocation is going to work? Who's going to decide how to divide up the new pot of money regardless of the source?
Yeah, so ultimately it's the Oversight and Accountability Council appointed by the Oregon Health Authority. The money doesn't get intermingled with Oregon Health Authority funds. It's its own drug treatment and recovery fund comprised of people who are addiction doctors, addiction researchers, social workers, recovery mentors, people in recovery themselves, people disproportionately harmed by the impact of the drug war. And they will have a say of where the money goes through a grant process and must go in all regions of the state. And every 2 years, we'll have an audit. A Secretary of State will do a comprehensive audit. There'll be a public report. Advocates, legislators, policymakers will get to see where the money's going, benchmarks for success, and we'll be able to adapt over time. That's one of the beauties of Measure 110, is that we create a scaffolding that ends harmful arrests, generates more revenue for drug treatment recovery programs, but leaves it up to the experts, but then again gives voters and policymakers the transparency to know where the money's going, and we can adapt over time. Today,
Okay.
how do we know where the money's going? This is an improvement over the transparent process, any transparent process we have now.
Great, thanks. Haven, sorry, you wanted to say something before and I cut you off.
I did. I think it's really important to remember that like inpatient treatment is a short period of time, and we know if we can support people through when they get out, they are less likely to go back in. So I run a syringe exchange program here in Portland, and I see people cycle in and out of treatment all the time. And so if we can get them the supports on the back end so that they don't resume use and end up needing inpatient treatment again, we will have more open beds in our current treatment model, because we won't have people going to treatment 10, 20, 30 times throughout the course of a 5-year period.
So,
Yeah, exactly. This is
could we,
Monta, Executive Director at Bridges of the Change. And I just wanted to share that, you know, here at Bridges of the Change, we're deeply focused on our anti-racist work. And above everything else in this measure, well, first let me say that we're the largest peer-run organization in the state, along with second, which is Mental Health Addiction Association of Oregon. So we hold probably 70% of the peer-run organization's workforce, and we are fully in support of Measure 110. We provide treatment services, housing, and peer services in 5 counties in the state. This measure is most important to us, which came up in the very beginning of the discussion, which I think should be the highlight of this measure, is that according to the Criminal Justice Commission, this measure on its own has the ability to reduce arrests and convictions by 94 to 95% for our Black and Brown communities. That alone for us at Bridges is enough for us to get behind and support this measure. But as we've heard from Brent and other folks, part of this, that it does way much more than that. And so the problem that I'm hearing in this conversation, the problem as a person on the board of Oregon Council of Behavioral Health who came out in opposition, is that we continue to discuss white dominant funding systems, and we prioritize those over how we can address racial justice in this state specifically. I'd also like to say that, you know, Mike Marshall said that, I think he said, this doesn't address driving while Black, which really shows kind of the, frankly, the ignorance around understanding systemic racism. Decriminalizing these folks for our Black and Brown communities who are most impacted is a huge win for dismantling our deeply racist system in its roots. And I think that in and of itself of Measure 110 is the reason to get behind and support this. And we can work out all this process stuff that we're really talking about, the process of how it works. So I would, you know, for us, we're always focused on the racial justice piece, and we can work out the process later.
okay,
I'd like to.
thank you. Jim, can you hold just 1 sec? I'll
Sure.
come to you next, but I have a question for the opponents. So you know, the opponents of the measure have made a lot out of the fact that this is funded by the Drug Policy Alliance, who has a long history of activism in Oregon. But I'm curious, what is the model? What city are we modeling, or what state are we modeling this program on? Where has decriminalization in the form that we're suggesting here been tried, and where has it been effective?
That for the proponents?
Yeah, so tell me, yeah, where did this idea come from? Where's it worked?
I think Haven, I think that's best for
I'll take
you.
that. So I have been in conversations with DPA about decriminalization for probably close to a decade. They're friends and colleagues and funders of mine. And we are really looking at Portugal in terms of how we are modeling this. Portugal decriminalized all drugs nearly 20 years ago, and they saw significant reductions in youth rates of drug use. They saw significant reductions in overdose death, HIV, hepatitis, increase rates of people accessing treatment. And so we really were looking at that as a model. We also really looked into like the LEAD program, which is active throughout our state. So the law enforcement assisted diversion programs, which are pre-arrest diversions into full spectrum recovery support services. And those are evidence-based also to show that people are accessing treatment. And so we actually do have LEAD programs in Multnomah County, in Clackamas County, and across our state already that are working, but they're not funded to scale or scope. And so this will really help expand access to that model going forward.
Okay. Jim O'Rourke, you want to jump in?
Yes, well, I'm going to just follow on something Haven said. So what's interesting is San Francisco as a one in America, and their law enforcement decided to relax enforcement of drug laws for adults. And so they have a tremendously increased overdose rate. The interesting corollary of that is they didn't decriminalize drugs, so their juvenile system is intact. The other point I wanted to mention is that we talk about 8,000 arrests, 3,700 convictions. Defense lawyers are good, but they're not that great. What's going on with those other 4,300 people is that most of them are diverting out. They're going to treatment, they're successfully completing treatment, and they're getting their charges dismissed. Finally, with regard to juvenile courts do not, they have no purpose of incarceration. They're social working courts. Their purpose is to rehabilitate the children, help their families. It's all community-based treatment. When it's residential, it is followed by monitoring, and they're held accountable to complete their treatment component after they've finished the discrete residential piece. Thank you.
Brent,
just really quickly.
Nigel, I think Siada
what
wanted
Jim
to say
and what
something.
Haven said is that just on that one issue, there is a really great study out of LA County that was just released looking at the effectiveness of their lead-based programs as opposed to drug courts. And those lead-based programs outperform compulsory treatment at 3-to-1 rate. And I can get you that study. It's not that drug courts don't serve some and that they aren't effective sometimes. It's just they're not effective for most people.
Okay, Siad, I'm sorry, I mispronounced it.
Siadam. Yeah, thanks. Siadam Edmo. I'm Shoshone Bannock Nez Person Yakima, and I'm the co-chair of Oregon Recovers. You know, I want to speak to some of the racial justice claims of the Yes work. And, you know, if I had $2 to $5 million or however much the DPA has invested here to develop in community a measure that was going to, you know, address addiction recovery or work on decriminalization. I mean, for me personally, like, I would totally be down for a straight decrim bill. Like, I'm like, sign me up all day long. But this isn't that. And it's, you know, if I look at good policy and how it's developed, it involves and engages people who are the most impacted at the very outset. And this campaign didn't do that. You have only one of the 9 tribes involved and engaged, and it wasn't until after the bill was filed that they actually were involved. So I would hope that the opposition would stop saying like the I in BIPOC, because it's clear the intent wasn't there to include tribal communities in engaging with this bill or this measure. And, you know, if they had been, I think we probably would have seen something similar to the Clean Energy Jobs Bill, which is an explicit tribal set aside, and that didn't happen either. This idea of like broad commitments, like just assuming that Indigenous people and tribal people are going to be served is just not true. Without having those most impacted, and including tribal people at the table at every step of the development of this, and that wasn't the case. So did I trust the development? No. Am I going to trust the implementation? Probably not. That it's going to, like, there comes a point after you know, well, that can be fixed on implementation. Well, that can be fixed on implementation, that you just shouldn't implement it at all. That you should go back to the drawing board and say, hey, what do we need as a community? Thanks.
Yeah, and if I could just jump in, you know, on the process ultimately is not going to be on the ballot. You know, what's on the ballot is either the current racist failed system or a new health-based approach that ends these harmful arrests. And BIPOC communities are going to stop being disproportionately arrested inside it. You know, for Jim O'Rourke to think that getting arrested for a small amount of drugs is like no big deal because you're diverted out, it is a big deal. It's a big deal for people like Bobby. It's a big deal for a lot of people. It's a big deal for a lot of juveniles that can't afford to hire an attorney like James O'Rourke, and they end up violating their probation and end up ensnared in the criminal justice system. You know, right now we have a two-tiered system, one for the rich, one for the poor, one that's good for people that can afford to pay Jim O'Rourke, and one that's bad for BIPOC communities that can't afford, don't have those kind of resources or family structure. And we're going to continue to take away their educational, employment, and housing opportunities for something that, you know, Mike says he agrees with 90% of this. Yadam agrees with the decriminalization, but Jim O'Rourke seems to, you know, think the current system works fine for his clients, but it's not fine for thousands upon thousands of people, and people are dying. Haven has to call people all the time to notify people of their deaths, because 1 to 2 Oregonians are dying every day. During the course of this interview, another person, more likely a brown or black person, is going to be arrested for a small amount of drugs, have their lives upended or ruined, potentially have a fatal law enforcement encounter, so we can work out the process later. No, let's decriminalize in thousands of harmful arrests, create millions of dollars of revenue for more treatment recovery services, and then work with the legislature together to implement this process as well as possible.
So Anthony, let me ask you, I know obviously you were very involved in the marijuana cannabis measure 2014. It seems like a long time ago. Why are we doing this? Is giant policy. This decriminalization is giant policy. The redirection of hundreds of millions of dollars is giant policy. How that money is going to be spent, giant policy. Why are we doing all this giant policy through a ballot measure at a time when, you know, we've never seen a busier ballot than the 2020 November ballot? I'm sure a lot of people don't even know this measure exists, despite the fact that you guys have spent a lot of money trying to make sure they do know it exists. So why didn't you go to the legislature to do this instead of doing it on the ballot?
So there have been attempts at the legislature to reduce criminal penalties. The penalties for these possession charges that we decriminalized for, they went from a felony to a misdemeanor, but legislators aren't ready to decriminalize across the board. They'll be demonized by people like James O'Rourke. They'll demonize decriminalization in general, and the Sheriff's Association, the District Attorneys Association, and, you know, and so there are political consequences. So even when a legislator is progressive, they can be very cautious in the bills that they propose, particularly when they are seen as being controversial around drugs. We had to go to the legislature with the founders of Drug Policy Alliance in 1998 to legalize medical marijuana. Had to go to the voters because the legislature wouldn't pass medical marijuana. We had to go to the legislature to pass marijuana legalization in 2014. We had to go to the voters to pass the Death with Dignity Act. The Oregon legislature wasn't even going to legalize marriage equality. Voters we're going to have to put that on the ballot if it wasn't for the Supreme Court stepping in. So quite frankly, we are trying to prioritize this with the legislature. The legislature will have a big role in this measure, and many members of of our opposition tried to utilize the same funds to generate $5 million a year for drug treatment recovery programs, and they couldn't pass the bill the last 2 legislative sessions. So whenever you are divvying up money, whenever you're dealing with drugs or controversial issues, oftentimes you have to go to the people, because the legislatures are just too far behind. They may sponsor a bill, but serious movement around these issues is hard to do. And it was brought up that we don't expunge past offenses. Yeah, we didn't expunge past offenses for marijuana offenses in 2014 either, but then we expunged them after we passed it out the ballot through the legislature. So if you want momentum to have some racial justice, to apologize for the drug war, to pass expungement provisions, pass Measure 110, and that creates the momentum to pass further reforms in the future.
Nigel, can I just mention, there's one anecdote from the last legislative session that I think is really helpful and why that's not a viable path. Oregon Recovers had a signature bill that the Alana Club of Portland was a supporter of that would have created a new network of recovery support centers, not unlike what we're talking about under this bill, driven by peer support workers serving, you know, diverse communities across Oregon. That bill was for I think it was for $3 million and $5 million. And it was a great bill that didn't make it through the process. So that was the whole legislative cycle. Today we're talking about $100 million. We're talking about 4 times as many centers. So I think that we just can't move at the rate of this addiction epidemic fast enough through the legislative cycle. We need the voters' assistance.
Nigel, just to clarify, we pulled that bill and focused on increasing reimbursement rates by 20%, which actually went through, which was the first time in 10 years.
It went to a committee.
It absolutely went to a committee, and then
it went to a
stopped
committee.
it.
Yeah. It never made it to the floor. Never made it.
Yeah,
to the floor.
it did actually. I mean, no, you're right, because we pulled it. We talked with the governor's office and we talked with the treatment providers, and we decided we would put all of our focus on increasing reimbursement rates because that would increase access to treatment.
Yeah, I think there are probably different scenarios there, but sure.
But that's
Can
the
I just
political.
jump
That's
in
some of the
here
political
quick?
reasons why you got to go to the people.
So can I just jump in here quick? I love the idea of doing this through the legislature. I really do. But when I'm losing people I know every day and every week, and I'm like in this, and I called the medical examiner 5 times in the last 3 weeks to confirm death on people I know and care about. I'm tired of waiting, right? Like my community, many of our community on this call are, I'm sure both Monta, Brent, Mike, have lost participants that are engaging in their recovery supports as well. And I can't see why we have to wait. People are dying. We are in an epidemic. And, you know, I think it really speaks to the importance of this measure that we were able to collect enough signatures in a pandemic to get on it. We have over 110 endorsing organizations that are showing up. Our list of people who supports keeps growing. And
And the largest recovery support services provider in Oregon all support this measure. We wouldn't support something if we didn't feel like it would deliver needed care now. That you can shake your head at that, Mike, but that's not true. Like, I mean, that
well, the treatment
we have more integrity
providers,
than that.
the
Monta
addiction
has more integrity
doctors,
than that. Janie has more
and the
integrity
largest
than that. I have more
recovery organization don't support it. So, like, there's
wait,
a
what?
there's a reason the treatment providers don't support it. There's a
Sure.
reason
It
the addiction
doesn't.
doctors
Yeah,
don't
that's
support
a
it.
turf.
And there's a
funding
reason
battle.
Oregon
That's a
Recovers
turf
doesn't
funding.
support it. And the 3 of us have been in the arena for the last 3 years, building broad consensus around
We've been in
a
the field for
substantive,
20 years, Mike.
a substantive answer to our addiction crisis, which includes mitigating the past impacts of the war on drugs. Again, it's really unfortunate that we're having this conversation at this late moment, because the Drug Policy Alliance in New York wanted to win in a cheap state. And that's
No,
really,
there were
you
recovery
know,
advocates that wanted to win in a state that's suffering more than any
Brent,
other
please.
state in the union. We have the lowest rates of access, some of the highest death rates related to
Brent, let Mike finish, and then
You know, I think the folks of Willamette, we can appreciate, follow the money. Why are no Oregonians putting money into this ballot measure? They're spending upwards of $5 million, and it's the Drug Policy Alliance in New York, and now the Mark Zuckerberg and Facebook in San Francisco. How is that an Oregon solution to this problem? It's the fact that the addiction doctors are not supporting it. The fact that
that's not true. No. All the addiction doctors support it.
The Society of Addiction Medicine in Oregon is not
Jessica
supporting
Gregg,
the measure.
Brad, all the major
Okay.
addiction doctors, Andy
Individuals are supporting it, but the vast majority are not. They're represented by their Addiction Doctor Association of the.
That's not true.
Or
Okay,
Sam.
all right, Mike, let's give Brent a chance to respond to that. Brent,
Yeah, I mean, I think if we want addiction to be treated as a legitimate disease, then we need to look to the experts, and the leading addiction doctors in Oregon have spoken. They've spoken with a unified voice, and they've spoken loudly. Jessica Gregg, one of the most noted addiction specialists, a doctor from OHSU that's now the chief medical officer for DePaul, one of our largest Medicaid treatment centers in Oregon, is firmly on board. Brad Anderson from Kaiser Permanente came out early in support of this measure, was one of the first addiction medicine doctors and one who's practiced longer than any addiction medicine doctor in the state.
And then
On the
Kaiser
opponent's
decided
side,
not
no,
to
no, no,
endorse
not
it.
even to finish.
Yeah,
On the
so
opponent's
Kaiser-
side, they have
Mike,
On the opponent's side, they have one medical expert, one doctor who is a physiatrist. That is a spinal and pain specialist, not an addiction doctor. So when you look at the yes on 110 side, there are the leading addiction doctors across agencies. When you look at the opposition, there is one doctor who does not specialize in addition medicine, but is a licensed physiatrist.
Okay.
As
Great,
the Oregon
great.
Society of
So-
Addiction Medicine endorsed
different
it.
They
question.
don't oppose.
Mike,
don't oppose
I got a
this.
question. So the DAs in their ballot, in their statement of opposition, and I believe the police chiefs raised a specter that I think we need to address for people who are fortunate enough not to be involved in this directly, but maybe just regular citizens wondering, okay, what is Medford going to look like? What is Portland going to look like? What is every town going to look like under decriminalization? I believe the phrase open air drug markets appears more than once in those statements against. So Haven, what is Portland going to look like under decriminalization? Will there be drug dealing on every corner and all the sort of scare tactics that we've read about?
No, I honestly
What
don't.
What will it look like?
It will look like it looks now, except for the fact that instead of people getting arrested and pinned to the ground and taken into jail, they will be able to access healthcare. I mean, this is not going to make drugs legal. It's not like it's okay to be selling drugs. It's not like it's okay to be carrying large amounts of drugs. The amount of drugs that people are talking about with this measure are really personal use amounts of drugs. Like I have clients who use way more than the threshold set out in this bill every day. So it's not going to like turn into this scary doomsday scenario. We have that happening now. This is just going to be able to provide support to the people who need it, so maybe they don't continue in their use.
And Haven, what does it do for kids?
What does it do for kids? Can you clarify your question?
Sure. So basically, it's decriminalizing drugs for kids, heroin and meth for children.
That's
a really loaded.
It's decriminalizing drugs for everyone.
Well, okay, but kids obviously have their own set of circumstances. Parents are obviously going to be very concerned about
more
that.
treatment under 110 than they do currently.
Kids have access to drugs today. Let's be real. Like,
right.
I started doing drugs when I was 15.
So as Brent, sorry about that. As Brent well knows, you know, we heard 2 years ago that the best advice that a principal can give to a parent is to get your child arrested because the schools have no capacity, let alone resources.
No, I've never heard that, Mike.
Never heard anything.
Well, Allison Mann said it at our rally at the kickoff. So
yeah. Oh, no. Yeah, she talked about our broken system, that the best, yeah, that is an anecdote plucked out of context. She said that the only tool available was that, and then led with, that's why we need access to better, more robust treatment options. She didn't say that's the best tool. She's one of my...
Can I jump in here?
Never say that.
Yeah, go ahead, Monta,
Yeah,
please.
yeah, I can't believe we're arguing that arrest is the best access to care, especially for kids, because we could tear that apart all day long, I'm sure. I wanted to come back to a couple questions.
I'm not saying it's the best. I'm saying it's the only one, and to deconstruct one without building up another.
Monta has the floor.
Yeah.
Monta has the floor.
I think I could be wrong, but I think I'm the only treatment provider on the call. I've been providing treatment services since 2008. At Bridges of Change, we manage about $12 million a year in funding for treatment services from a variety of places. And what we see I think the question to Haven was like, what are the streets going to look like? What I'm really excited about this bill is because right now, it's really disjointed trying to figure out where to gain access to care. It's like, oh, I got to get on a wait list here. People are navigating this in the midst of their moment of clarity, trying to get help, and it's hard for folks to access it. These recovery access sites not only create a pathway to get into whatever level of care that they may need, but it also creates a wraparound support so those peers, those people with lived experience, case managers can track them and stay connected and get them, because a lot of times people get on a wait list and they fall off because they weren't able to maintain their level of interest. And so these folks can create kind of a warm handoff into other systems of care. Now, no one knew COVID was going to happen. We're all hit with this. We're going to walk into this next biennium in a very scary budget cycle. I'm also very excited about this bill because it immediately infuses this money into our much needed broken recovery system. And so where we didn't see this coming, who knows what the cuts are going to look like in behavioral health across the board in this next biennium. And this marijuana money ensures that we're going to have some dollars infused into this system so we can create access. And so I think those are important issues to note, especially as a provider who's trying to provide the care for folks right now as fast and as quick as access possible. So
Yeah. And Nigel, I just want to say those like same like fear mongering and what's going to happen on the streets and with kids are the same thing that the law enforcement lobbyists did with medical marijuana, with marijuana legalization, and they're doing it now. But it's very telling that this measure has Mike Schmidt endorsing it, has John Hummel for Deschutes County endorsing it, Matt Ellis from Wasco County endorsing it, because DAs that are smart on crime, instead of just continuing the current failed racist system that just wastes our taxpayer dollars, they understand we need a new approach based upon healthcare. You know, this is a health-based issue. Why would we want to criminalize people for something that's a medical issue, that's a health issue? It's nonsensical and just wasting time and ruining lives for no reason.
Which is exactly what Oregon Recovers really was working towards in the very beginning. It was all about remove all of law enforcement off the ADPC, the Alcohol and Drug Policy Commission. We wanted to remove out of everything. And
we actually ran a candidate against the sitting judge of the Alcohol and Drug Policy Commission because we felt like having a public health approach was the right approach for the commission. And so Oregon Recovers supported Brad Anderson, an addiction doctor who supports 110, to serve as chair of that.
Well, so here we are on the opposite side where now Oregon Recovers is at the table in opposition and using criminal justice as what we should keep using because everything's
Monta, I think that's not a fair characterization. What we're concerned about here is that we both agree that dealing with addiction within the context of the criminal justice system is a huge mistake. And what you want to do with Measure 110 is push everybody into the healthcare system. And what we're saying is the healthcare system is not set up yet to take that. And so you're putting the cart before the horse, for all respect. And then the net effect of that will be, instead of moving people out of the courthouse into the hospital, figuratively, you're going to move them out into the street.
Into
and
community-based
this system, sorry, hold on, let me just finish. And the way you've set up the funding part of this, or the way the Drug Policy Alliance set up the funding part of this, is very piecemeal. And what's going to happen is organizations like the ones represented on this call who have development directors and have a plan in place and can articulate that, look, these are the communities we serve and we want to expand out to these communities, it's going to be great. But go to Coos Bay, go to Klamath Falls, go to Burns, go to Pendleton. There's no infrastructure. And a group of volunteers that meet once a month and look at grant proposals that are not required to align with any kind of equity goals, let alone strategic goals, are going to piecemeal money, and they're going to favor, at least initially, those organizations like yours, which are well-established, under-resourced, but way better resourced than whole big pockets. As you guys well know, the mission of Oregon Recovers is to address the fact that the system is fractured and incomplete. And by creating a grant program, you're going to continue to keep it fractured because you're not requiring you're not building any strategic thinking into the allocation of building up a healthcare system. It shouldn't be the job of volunteers. It should be the job of the Oregon Health Authority to build that system.
I'd like the other side to respond to that. That's a very clear critique of this measure. I'd like one of you guys to take, one of you, doesn't have to be guys, one of you can take that on.
Yeah,
because if I'm hearing what Mike is saying, it's a repeat on a smaller scale of what we did with the mental health system, where we looked at the institutions, said these are inhumane, they're not serving people, let's close them, and we pushed millions of people nationally out onto the streets with no response. So that's the critique he has leveled. Monty, you take a crack at that first.
Yeah, because this is a really important point that's brought up, and I agree with Mike if that's how it was going to work, but that's not how it's working. Just with personal experience, I have over 25 arrests, 4 prison terms, over 10 years incarcerated. And, you know, just to say that, what if I didn't get all my treatment until my last time in prison, right? So what would have happened on the front end? But besides that, this does not totally shut down the criminal justice door. We all know, especially people like me, who have co-occurring criminal disorders, is what I'll call them. We might end up with a possession, but we also end up with, oh, we stole a car. We did identity theft, right? Those systems are still in place, so it's not a complete removal of the criminal justice system, right? It's a small removal of possession. It addresses a racial justice approach, but it doesn't like open the floodgates for all these other folks that are still have the, I'll say the behaviors that come along with addiction that get people wrapped up into the criminal justice system. So I don't see this opening up a big floodgate and then the world's on fire, you know?
I'll also jump in real quick and just say the vast majority of the clients that I serve who get access to drug court, it isn't because of a simple possession charge. It is multiple arrests for multiple offenses. And so that's why I truly believe drug courts aren't going anywhere. And they're helpful for those they're helpful for.
So the question, Hayden, the part of the question that I think is you guys haven't fully answered to our satisfaction is, I think what Mike is saying is, okay, DePaul or whatever the big Portland treatment centers, maybe big treatment centers or organizations in the Willamette Valley have the sophistication and the infrastructure to compete successfully for a pot of money. But we know that substance abuse disorder occurs in every small town in Oregon.
Yep.
So I think he's asking the question, what's going to happen in those places where there isn't a development office or there isn't the infrastructure or the sophistication of the people that's on this call to try and compete for those resources. So please respond to that.
Yeah, I'll take it first. So first of all, the Oregon Health Authority will appoint people who are experts in this area. Like I mentioned before, addiction doctors, researchers, treatment providers, people in recovery mentors themselves. And it mandates that money go to every coordinated care organization area of the state. So it has to go into every region of the state. So money will flow into rural areas, suburban areas, the coast, Eastern Oregon, the city. Money will go everywhere. And we know it's more money than what they have now. So what I'm hearing is like, we need to wait to have a perfect law or a law that Mike or whoever may be happy with implemented before we end these harmful criminal arrests. And that just seems crazy to me that we need to keep arresting people who aren't getting sent to treatment, because this measure does, like Haven mentioned, only applies to minor possession offenses. People that sell, that drive under the influence, that steal, commit other crimes are still going to have access to drug courts. This isn't like closing all the mental health institutions and letting everybody out in the streets to have a free-for-all like our opponents are trying to characterize. This is the limited number of offenses, and I'll let Brent finish.
I just think it's a bit insulting too to the provider networks that do exist. So yes, there's a lot of resources and a lot of organizations in the metropolitan area, but there are some incredible providers outside of the metropolitan area, and these are providers that Mike works with. First Step in Bay Area First Step, which is Coos County, does tremendous work. They're a comprehensive provider and would immediately benefit. And it's one of our hardest hit, natural resource communities. In Medford, there's ARC, a very sophisticated recovery services organization. So this money has a home in organizations that will immediately put it to use in some of our hardest hit areas.
Okay, I'd like to ask Bobby and Jim O'Rourke to tell us what they think we haven't heard yet, or to reiterate what they think we need to hear again. We're almost out of time here. Bobby, I'd love to hear from you first. Anything that we haven't heard yet, or you think we need to hear again?
Well, I'm blown away that we're sitting here talking about politics when we're talking about lives in the same context. I mean, lives to me are way more important than the politics of any measure or whatever the case may be. We're talking about lives being taken on a daily basis, whether it be by the police, whether it be by the epidemic, whether it be by an addiction. We need more recovery services, man. If 27 years ago, if I had had this access for me at this time, who knows where my life would have been. I probably would have been a phlebotomist by now. I probably would have been a drug and alcohol counselor. These things were cut off for me. When you talk about kids, when you give them a criminal record, it's going to saddle them for the rest of their lives. And it's going to hinder them from getting that job at Intel, from getting that job as a phlebotomist, from getting that job in any hospitals and things like that, from going to school and progressing and becoming citizens of America. Now, as Oregonians, man, we have a moral obligation to do the right thing. And the right thing is and this is like, we can make history right now. Waiting for it doesn't make any sense at all. We need to step up to the plate, and everybody needs to join in and lean in, because this not only benefits Measure 110 people, it benefits everyone in Oregon. Everyone will get a benefit from this. When someone is addicted to drugs and they're going through these changes, it affects not only that person, it affects everyone around them.
Okay,
So understand that, yeah.
thank you. Jim?
I have 3 points. One is from a citizen's point of view, just average Mary and Jane, Joe out there. Citizens probably want people intervened on and getting into treatment before they commit crimes where there are victims. And so we catch them early rather than later in the system when they have committed serious crimes where they're going to commit crimes where they can't get their records expunged easily. With regard to expunction, getting criminal records sealed for juveniles is much easier, and particularly for these crimes, it's pretty simple. The other thing is, in response to Mr. Johnson, I'm a part of a coalition which has had a bill pre-filed with the legislature which would relieve people of convictions for possession offenses, all the possession offenses covered by Measure 110 retrospectively, and then for people who already have convictions, and then would provide for immediate expunction upon completion of probation going forward. And then my final point is it's a little bit of a story and a kind of a celebration of a change. When I first started practicing law, I won DUI cases and the officers weren't happy with me. When I won drug cases, they didn't care. Finally, I asked, why don't you care when I win drug cases, but you get upset with me when I win DUI cases? And they said, because the drugs will take care of them. Now, that was the attitude we had 40 years ago. Now we have police officers who are, as Haven pointed out, they are trained interventionists. Those are the lead program officers. DA Clarkson in Marion County is proud that she has 75 officers trained to do interventions. Not only do they do interventions on people who are caught committing crimes, they will respond to parents or concerned family members and go out and do what they call a social intervention, where they will get people into treatment who haven't committed crimes. So for parents can call and get their children referred to treatment. And when I say children, I mean over 18, under 18, can get them referred to treatment. She currently has 19 people in treatment through the LEAD program. I think the LEAD program, I completely agree with Haven. That is where the criminal justice system should interface with people on possession charges. And that's, I think, our future. Criminal justice is always going to be in it. Everybody concedes that. People, if you don't arrest stop their addiction early, they're just going to keep going. They can commit crimes. They're going to get in the system. And there's going to be victims. And finally, with possession charges, we are not changing the fact that this bill provides for police contact with people with possession charges. It's a ticketing process, but it's still a police contact. So again, back to the LEAD program, let's have more officers trained on how to be interventionalists and helpers than the old style, the other styles of police that none of us like. All right, thank you very much.
I'm living proof though of how the system works, man. That's not true. The system didn't help me at all. Arresting me didn't help me one bit. Arresting me ruined my lives on a lot of different levels. When I told the officer that I had an addiction problem, no one offered me any treatment. No one offered me anything like that. No one offered me a direction or a path to go down, anything like that. I had to go look and find my own path.
Thank God things have changed.
Well, that's one of the greatest
Thank God
epiphanies
things
though,
have
right
changed.
now is that police aren't appropriate first responders when it comes to doing that intervention. It's a lot better than arresting somebody, but we know that that work needs to be done by social workers, by trained professionals. I think if anything we've seen, that's not officers. That's not how they are trained or what they're supposed to do.
Yeah, and Nigel, I think, it boils down to, what's on the ballot is the current system that Jim, seems to think works fine. But for people like Bobby and Monta, it has not worked fine. And that's what's on the ballot. And so I think it's been a big distraction about whether this is funded by the Drug Policy Alliance, where, over 80% of our donors are from Oregon. And it's really discounting Haven and Janie Gullickson and Brent and Monta and Ed Blackburn and Richard Harris, people that have been working in this field for a long time that support this measure. When you have Dr. Andy Seaman and Jessica Gregg and David Lawrence and, Todd Corthius, and, we have all these addiction doctors and people in recovery and people that work in treatment, recovery mentors, all the people from Oregon that support this measure. They want this measure because it's passed for Oregon. And it's really insulting to think like DPA is trying to buy this election or that we are like puppets of DPA. DPA is not on the ballot. The preferred strategy of the ADPC is not on the ballot. The preferred law that I or
Nigel?
Bobby or Jim or Mike or Brent or anybody wants to pass is not on the ballot. There are two things on the ballot: the current failed racist system or a new approach that's based on healthcare and not arresting people for minor drug offenses, disproportionately people of color.
All right, Mike, last word, and then we'll
Yeah.
wrap up.
So, I don't know, Anthony, but I really appreciate what Bobby and Monta both have gone through and how the system really, really, truly failed them. It failed all of us at some level, right? Because of my privilege, I was never arrested, and that was the only intervention that could have worked on me. But it's, Bobby was arrested, I think, in the early 90s. Monta, I don't know, but it was 20 years ago, right? Or 15 years ago. The system has changed. The legislature did act in 2017. They did decriminalize. They did put money into treatment. And so the question here is, why are we spending $5 million to help 3,700 people when we have 400,000 people in active addiction in Oregon and another 400,000 who identify as in recovery? And how is this measure, how is this measure going to help those 400,000 people? And how is it going to help the other 400,000 people in recovery? And I would argue for many of them, this measure, because of the way it's so poorly written, even in the short term, but also in the long term, is going to undermine their health and well-being.
Great. Yeah. Okay. Listen, we could do this all day. It's a fascinating topic. I first want to apologize to everybody for the technical difficulties at the beginning. Totally my fault. Thank you all for giving us your time today. Really appreciate it. And we'll have this endorsement. This video will be up online for everybody to see on the 14th, and our endorsement in this measure will be out that day as well. So thanks again to everybody. Really appreciate your time.
Thank you so much.
Thank you.
Thank you all.